And
I'm sorry.
am I recording?
It's right here.
Is the red light on?
Yeah.
Okay, you're recording.
Okay.
All right, so we'll start with the parietal pericardium, or the fibrous pericardium, which was at one time around the heart. Now it's not. But you can feel how tough and fibrous it is.
You need to page through it to see
And then, let's see.
How do we determine anterior and posterior?
The posterior side's a mess, where in the cut, where all the cut vessels are, and then the anterior side's more neat and smooth. So that's how you can orient yourself. And let's look at the different layers while we're in here. Where can you see the epicardium? You can kind of see the cut side of the. I'm dropping crap on the floor. You can see the cut side of the epicardium, that thin little white line. Then the big thick myocardium, which is especially thick on the left ventricle side. And then this little bit of endocardium that's come loose. So our journey is going to start in the left ventricle, and the blood's going to flow through the aortic valve, right? The aortic semilunar valve. I'm having trouble poking through. Up into the aorta. So here's where we cut our aorta in an attempt to find a coronary artery. Here's the aorta, the aortic arch, where it's going to flow through the rest of the body. It's going to return from the systemic circulation. It's going to return to the right atria, and through the right atria, it's going to flow through the tricuspid valve into the right ventricle. And here we can see the chordae tendineae and the papillary muscles. The papillary muscles are the little raised part of the myocardium. They're kind of hard to see, but nonetheless, that's a part of the chordae tendineae that makes up the tricuspid valve into the right ventricle. And then through there, that's going to flow through the pulmonary valve into the pulmonary artery, which is going to flow to the lungs and back. Which one did we decide was a pulmonary vein?
That one.
Yep, because here's where the pulmonary artery exits into the lungs, flows back to the pulmonary vein, collects into the left atrium, where we'll start over again.
And down through the left atrium, down through the mitral valve, or the bicuspid.
Or there's one more. The left atria ventricular valve. But I think on the lab objectives we're using the terms bicuspid valve and tricuspid valve. Are we missing anything? And then just the interventricular septum, the intraatrial septum. We forgot all about the superior and inferior vena cava. The superior vena cava is going to flow from the superior parts of the body back to the right atrium, and then the inferior vena cava is going to do the same. Actually, that's not even the superior vena cava.
Stick your finger in there.
This is.
There you go.
That's
Thank you very much, David.
right. Oh, I'm in trouble. Yeah, there we go. Okay. I think we got all the objectives.
Okay.
Am I missing anything?
No, I think you're good. All right.
Sorry.
So, how do I?
Movie again.